In other news, the police administration will be resolute and firm in the application of the law enforcing the wearing of face masks. The measure is considered among the key interventions needed to stop the spread of the coronavirus pandemic. Those found guilty of flouting the law as spelled out in Executive Instrument 164 are to be fined a minimum of 12,000 cedis or a maximum of 60,000 cedis or sentenced to between 4 and 10 years in prison. With Ghana's case count now at nearly 2,000 active cases and 352 deaths, and with the discovery of new strains of the virus in Ghana, the need to step up. The fight has become imperative, as stated by President Akufo-Addo when he updated the nation Sunday night.
I've instructed the Inspector General of Police to direct officers, men and women of the police service, to ensure the rigorous enforcement of the law on mask wearing at all public places and in public transport. They're also to ensure the closure of all nightclubs, pubs, cinemas and beaches that may be operating in defiance of the law. They will be assisted by the other security agencies if need be. Persons in marketplaces, workplaces, and operators of public transport must conduct their activities in accordance with the hygiene and safety protocols. The wearing of masks in these places is mandatory. Regulatory agencies will undertake random checks to ensure conformity with COVID-19 rules. Should any facility or institution fail to comply with these directives, its activities will be immediately prohibited and appropriate sanctions applied. It is important that I remind all Ghanaians that severe punishments exist on our statute books for persons breaking the law on the mandatory wearing of masks. Should anyone be arrested by the security agencies disregarding this directive, that person will be dealt with strictly in accordance with law. We do not want to go back to the days of partial lockdowns, which had a negative impact on our economy and on our way of life. But should that become necessary, that is, should the number of active cases continue to increase at the current rate, I will have no option but to reimpose these restrictions, because it is better to be safe than to be sorry.
A number of the new cases recorded so far have presented unfamiliar symptoms, including waist pains and sudden death without any underlying health problems. The development is prompting fears Ghana could be harboring a new strain of the virus. Now, how different or similar are symptoms of the new variants? Dr. Yabediako, an immunologist at the West Africa Center for Cell Biology and Infectious Pathogens, tells us more.
So for now, so far, all the variants, and this is not just in Ghana, all the variants that have so far been detected globally, none have been demonstrated to cause more severe disease. So it appears that, COVID, depending on who you are, in different people presents different. But so far, there is no evidence of a particular variant that causes more severe disease. Having said that, as I said, these two variants that have been identified recently, and that unfortunately we now have at least found at the airport, these have been shown to be more highly transmissible. So what that means is they are transmitted from person to person much more easily than the previous variant. So while they may not cause an individual to be more severely sick than the COVID the variants that were circulating previously, the number of people that a single infected person can infect if they have this new variant is significantly more. And so that means that, if in a household you had one infected person in the past, they may not, they will probably not infect that many people in the same house. But with this highly transmissible variant, the chances of more people in the household being infected is raised. The same for public transportation or in an office or in a crowded area. Now, if one person has that new variant, the likelihood of multiple people in their surroundings being infected is significantly increased. In fact, the UK variant is 70% more transmissible than the quote-unquote original strain. Well, I mean, scientifically, we are yet to fully understand what makes this virus more transmissible.
Okay.
But I would say that, yes, social distancing, yes, the virus may not necessarily travel further, although it may persist longer. We don't yet know why it is more transmissible. But certainly, the time required to become infected is probably less.
Now, there's growing criticism of political parties whose activities may have contributed to the spike in the COVID-19 numbers. Chairperson of the Board of Trustees for the National COVID-19 Trust Fund, Madam Sophia Akufo, is the latest to cite political rallies and parties during Christmas and other super spreader events for the recent uptick in cases. This is despite a debunking of the theory by the President's representative at the Information Ministry, Kojo Oppong-Nkrumah, who insists the data does not support that assertion.
Well, if you take the election period, I'm sure the doctors in the studio will tell you the data will not support that argument. I know it's fanciful for us to make that argument. Election period was on the 7th of December, thereabout. So you're looking at about 14 days around that period. You don't see those numbers. But the Yuletide, the 25th coming to the New Year era, you'll notice, and they even have specifics when they do the tracing, they have specifics of events under which persons turned positive, which is now what is leading to the about 200 average cases a day. There's clear data and clear science to support this argument. So I want us to be very clear on that one.
His comments have drawn criticism from health experts who have described Mr. Oppong-Nkrumah's utterances as misleading and unfortunate. Deputy General Secretary of the Ghana Medical Association, Dr. Titus Buah, and Kwame Sapong-Esiri of CDD Ghana spoke earlier on Joy FM Super Morning Show.
Anybody who dies 28 days after a positive test is considered to have died of COVID. That's how the reports are made. So you need to add 5 days to that 28 days to guess when the person was infected. That makes it 33 days. So the ripple effect of what you see manifesting and causing us concern now didn't start today. And we need to get these basic numbers straight. That is why I cringe when I hear people trying to labor the point and behave as if you have to calculate from the time the person tested positive. Sometimes the person might even have gone past their latent period, might be asymptomatic, and would only avail themselves for a test when they are getting progressively worse, especially with our current testing regimen, which requires that you have to get progressively worse and then go into a health facility before you fit the case definition and get tested. So majority of the people are actually availing themselves to testing after around day 9, day 10 because of our testing protocol. So when I hear people then, based on this simple arithmetic addition, try and throw dust in my face that mass gatherings at the end of November contributed nothing, I ask myself, am I reading Greek? And I'm sorry, but I'm not. I'm reading epidemiology. And I'm reading the numbers as per the journey of this virus.
Who are the people running around the political rallies? Healthy young people. How many people after a rally were tested? No one. When did we say that, okay, after this political rally, we are testing the people to see whether they have gotten an infection or not? We didn't. These people are healthy, fit young people. How many of our grandparents can go and shout and scream in their gatherings? They won't be there. Now, when they get that infection at that period of time, they were not tested. There was no mass testing going on. We had restricted testing to only symptomatic people. Most of these people did not come in for any testing. So if you have not tested them, how then do you say that political activity does not contribute to the spread of the virus?
But isn't that why they say the data they have?
How do you generate the data? If you deliberately collect data from a particular segment and use it to interpret it for how you want it, then it will give you the kind of information you want.
I mean,
the data is, the source of the data is as important as its interpretation. If you are not testing the entire community, you are testing only people who have come to hospital. You are testing people who are sick. Some of whom, by the time you are testing, have no viremia, and therefore you test and they may look negative, but they are having post-COVID syndrome. And you base that your policy on that data. Where are we going to?
Welcome back to Joynews Prime. We're going back to our earlier story where the political rallies, or those involved with the political rallies, have sought to distance themselves from the recent spike in COVID-19 cases. Well, former Chief Justice Sophia Akufo tells Joynews that politicians cannot be absolved of blame. She spoke exclusively with my colleague Latif Idris.
Your elbow, you're too close.
let's not joke with this disease. Ghana, when bad situations persist for a while, and we start making jokes about it. This pandemic is no joking matter. The numbers are going rapidly up because towards the end of the year, there were just too many super spreader events. So the children, the young people, they should decide that now it is hip, now it is in, now it is, what are their expressions? It's cool to keep your mask on. And when you wear the mask, you're masking your nose and your mouth. I like your mask. It keeps your nose properly covered, even when you're talking. Thank you. You know, because it's important to keep both the nose, because you breathe through the nose and you talk through the mouth. Teachers must also set an example, and they should wear their masks properly, and they should constantly monitoring the children, the washing of hands, the taking of temperatures, keeping an eye on those who suddenly look not too well, and everything.
In super spread events, maybe you can highlight on those so that we do not go back and lower our guard so that we get another hit.
The super spreaders, the rallies. I stopped watching TV when before the elections. I stopped watching because my heart will be jumping, because I just could, people are excited, they are together, they are not wearing masks, they are shouting. That's a super spreader. Parties are super spreaders. Large gatherings without masks, people bunched together.
For instance, what we saw at the beaches.
Oh, yeah. You think you're having fun, but for some people, it has become a death sentence.